let's face it, you can't avoid it. We're all getting older.
That's right. Yeah, that is true. It's one of life's truths, right? So let's talk about this. As we age, many of us will experience more medical problems, and one of those medical problems could be the link between aging and depression.
So we are happy to welcome Dr. Gary Small, the chair of psychiatry at Hackensack Meridian Health. He is a renowned expert on aging, brain health, and geriatric psychiatry. So good morning to you. Thanks for being here.
Good morning. It's great to be here.
Yeah, so, let's talk about this, right? Because we're all getting older, and it's a fact of life for everybody. So just how big of a problem is it that you're seeing, I guess, is the correlation between age and then more and more depression cases?
The reality is that depression is not a normal part of aging. But at some point in our life, including when we get older, about 1 out of 5 of us will develop a depression that needs help from a doctor.
Right.
Is there something that triggers it specifically?
Sometimes there can be a loss, isolation, a lot of risk factors, but also there's a genetic component. So if you have a family history of depression, your risk is going to be greater. And if you've had depressions when you were younger, that increases your risk as well.
Yeah, and you're also talking a lot about forgetfulness that can make people depressed, and many of us chalk up, I guess, forgetfulness as you get older to aging. And is that true? Is there a correlation?
There is. Age is actually the greatest risk factor for forgetfulness and memory loss. And that makes it complicated in recognizing depression in older adults, because one of the symptoms of depression is loss of concentration and memory decline. So sometimes older patients with depression may be confused with having Alzheimer's disease.
Oh, wow. Well, there are things that we can do, though, because I know my dad does things, he's in his 80s, but he does things like Sudoku, he does crossword puzzles to try to keep his brain sharp. Does that kind of thing actually help?
It does help to some extent, not only for your cognitive health, but also for your mood. So staying engaged in activities that interest you, remaining socially active, these are important ways to mitigate the risk for depression.
Yeah, because you talk about 4 concepts that make up this formula for aging successfully, right? Mental exercise, physical activity, stress management, healthy diet. They all sound great. They're tough to do sometimes.
Well, yes, it's hard to get into the habit, but you want to do it gradually and get into it. And once you start exercising regularly, once you eat healthy, get enough sleep, it feels good. So you're motivated to continue those healthy lifestyle habits.
But are we all equal, though, as far as race is considered? Are there certain ethnicities that are more susceptible?
There are to some extent. And, for example, isolated men have a greater risk for suicide risk as they get older.
Wow.
And the same thing with men of color. So
What do you mean by isolated?
Alone.
Okay.
Divorced.
Yeah.
Widowed. And that can be very difficult. And I think the pandemic was very difficult for all of us, young people and old people, because of the social isolation. But it's not just about exercise and diet. If you have a depression that's really interfering with your life, it's important to get professional help. Because we know that at any age, medication, psychotherapy, or both can help depression. So it's something that can definitely be treated.
Yeah, absolutely. And you're talking about treatment too, but you turn on the TV, you see so many commercials for different supplements or ads for supplements that are supposed to keep your brain sharp, to kind of ward off some of these things. Are those the kinds of treatments you're talking about?
Unfortunately, supplements aren't tested to the same degree that medications are. So what they advertise may not be what you're actually getting. So I think it's much more important if you're feeling isolated, depressed, suicidal, any of those experiences, it's important to get help. And also remember that depression is not just psychological symptoms, but physical symptoms as well. It can be back pain, it can be insomnia, weight loss. So sometimes in older people, we talk about a masked depression where it looks like a physical illness, but there's really a depression that's treatable.
Now, you talk about the use of prescription, like antidepressants. I mean, they do work in some cases, but don't. But when you're talking about those over-the-counter things, I know a lot of people, including myself, when I see things like that, I wonder, do they actually work? Are there over-the-counter supplements that do work?
Well, there are. I mean, there's a whole area of supplements, and some of them have been tested with the scientific method used to test drugs. But it's hard to find them, and the consistency can vary. So if you have a question, talk with your doctor or a knowledgeable pharmacist.
All fascinating information and good information as we all get older. Oh, gosh, yeah, it's a sign of life. Dr. Gary Small, thank you so much, Chair of Psychiatry over at Hackensack Meridian Health. Appreciate you being here.
My pleasure. Thank
By
you.
the way, once again, 4 tips for successful aging. I'll just throw them up for you that we talked about. Mental exercise, physical activity, management, and healthy diet. All right, there you go.
All righty.